Okay, it's time now for a health report, and joining us is Africa 54 health correspondent Lino Mudu with the latest on child mortality. Lino?
Thank you, Esther. The United Nations Children's Agency says child mortality remains a great challenge in Madagascar. Every year, about 44,000 children die before their 5th birthday from preventable causes such as pneumonia, malaria, and diarrhea. And statistics show a high rate of maternal mortality, about 478 deaths per 100,000 live births for 2 decades. I recently spoke to Eliane Razafimandimby. She is Chief of Party of the USAID-funded Maternal and Child Survival Program in Madagascar and Jhpiego's country director, and I asked her how the maternal and child health challenges are being addressed.
For about 20 years now, the maternal death rate has been stagnant, which means that despite all the efforts we've done, we have not made progress on that.
But why?
Well, there are many reasons. When MCSP started the program, yes. We did an assessment to exactly see what was the problem. And some of the results show that there was significant gap in the facilities.
Okay.
And that includes providers that were not properly trained. There were issues of commodities. I think one of the things that people forget to talk about is that when people are traveling a long distance often to go to a facility.
Yes.
And yet when they arrive to a facility, sometimes they don't find a doctor, sometimes there's no medicine, but also they don't get treated well.
Okay.
That's a big issue. I mean, when you come to deliver to a facility and you're not treated well, you don't want to go there.
So there are many challenges then. What are the strategies to address these challenges?
Well, I mean, one of the primary activity we did was, of course, to work on the capacity building.
Okay.
And that was a major priority for the government, because we needed to really train a lot of providers, update all the providers. That was one, but we needed to work at a different level. So we worked first with the ministry at national level to first update all the key documents. So we needed a proper standard and protocol for delivery, for antenatal, all of this needed to be updated. Then we had all the work capacity building at the district level, train these regional people to be able to supervise properly the facility, to conduct training properly. And then at the facility, of course, we trained the providers. They needed the training, they needed supervision, they needed equipment also. We provided some equipment, basic equipment for the... And also we, this was not enough. I mean, how do we actually improve care and measure it?
Yes, how do we measure the
yes,
success?
So we supported the facilities to introduce and monitor what we call the data dashboard. So it may sound a bit complicated. Basically, it's just we have 8 indicators that monitor what they're doing. They are color-coded.
Okay.
So every month they monitor the performance of the facility.
Okay.
And each provider, each facility is able to know, okay, are we doing with antenatal care? Are we doing with delivery? How are we doing? So it's really measuring that. And in fact, this dashboard actually improved the performance of the providers because they can see what they're doing.
So then, what can you tell us before we wrap? The next 5 years, what type of change do you hope to see?
We hope, I think what we introduced was changing the culture, at least from what we did in the program, that changing the frame of mind, using data for decision making, not just do things routinely, but try to really make decisions based on evidence. So I think that's one thing that we introduced, and we hope that we planted the seed. But there's a lot more to do.
Yes.
A lot more to do in the country.
Yes.
I think it's important that we address the health system as a whole. We have to be looking at the holistic way, how to improve things, because we planted something, but we have to continue all the work, and this requires a lot of leadership at the national level with the ministry, but also at the district and also at the facility level.
And people also have to take ownership of their health. Yes. They have to be part of the solution,
yes,
right?
Yes,
okay.
That's true. People, we have to engage the community in this, and in fact, we try to do that. And they can actually make some small changes. They don't work at the clinical level, but they can make some changes at a different level. That includes, for example, in some of the facilities we supported, they help, for example, build a shelter for pregnant women waiting for antenatal care. They help do small things like that can improve quality of care for the facilities.
Well, we have to leave it there, Eliane. Thank you so much for your time today.
Yeah.
That was Eliane Razafimandimby, Jhpiego's country director in Madagascar.